Glad you're joining again to the Wellness Revolution. Dr. Veronica here, and I have with me today a gentleman who is a physician, a family physician who now concentrates specifically on holistic medicine, holistic treatments, and electromagnetic frequency treatments. And you're saying, well, what is that? You know, I tell you about being a medical intuitive and reading people's energy and bioenergetics and all that. That is era 3 medicine. Era 1, pharmaceuticals and surgery. Era 2, lifestyle medicine, strategic eating, targeted supplements, mindfulness. Era 3 is your energy field, and your energy field gives the information to your body as to what to do. So this is very important. So Dr. William Pawluk has been on the faculty of Hopkins, Johns Hopkins, one of the best medical schools in the world, Rutgers, been on Dr. Oz, and today he's on the Wellness Revolution with me. I met this gentleman, and I was like, oh my gosh, I just started using pulsed electromagnetic frequency, and I got this amazing result immediately. So I want you to know about this. Dr. Pawluk, welcome to the Wellness Revolution.
Well, thank you so very much for having me on the show. I look forward to working with you.
Yes. And so let's talk a little bit, jump right in about your background. You went from being a family physician, and you still are. We're always our primary wherever we started. But now you're concentrating specifically on holistic treatments and pulsed electromagnetic therapy. What was your moment where you say, I got to do it different?
That's a really good question. Actually, it's very compelling and very important. While I was a family physician, I was actually running a medical group of about 14 family doctors in New Jersey. It's the biggest medical group of family physicians on the whole East Coast of the U.S. at the time, and that was 1974. And after the second or third admission to the hospital for GI bleeding from non-steroidal anti-inflammatories, ibuprofen, right? And one person died, and that was not in my group, but there was one person on the floor who actually died from that problem. I said, this is insanity. This is absolute craziness. What's the definition of insanity? Doing the same thing over and over again, right?
Same thing over and over again. But you're talking 1974, and we're still doing that stuff today.
And we still are doing that stuff today. Talk about phase 1 or level 1 medicine, stage 1 medicine. So I said, I told myself, this is stupid. I mean, this is really unconscionable as a physician. It's definitely not honorable. And when I looked around at my peers and I said, does anybody else have a better solution for pain management than that? And I said, no, nobody does. So I said, I gotta go outside the house of medicine. It says, because that doesn't have a solution. Not a safe solution, not a non-toxic solution, not a useful solution, not an inexpensive solution, and not a solution that you can do at home on your own. So I started to study acupuncture. I said, well, you can't fool 1 billion Chinese for 3,000 years. There's got to be something in acupuncture. So I knew that when I talked to my peers about it, I don't ask permission. I'm not even going to ask forgiveness. I'm just going to go out and learn it, right? And then I'll see what that can do, because obviously we don't have solutions. So I discovered as I was learning acupuncture, that was 1990 that I started doing acupuncture, my research and studies in acupuncture. And nobody wanted acupuncture. They put their hands up. No acupuncture, no needles. So I said, well, I got to find some other solution to needles, because at that time, Madonna had not had acupuncture yet. Right? It hadn't gone that public. So I discovered in the Orient, actually, they were using magnets on acupuncture points. And I dug into it. I discovered there were people who were selling magnets. I got a bunch of magnets. I worked with them for a while. Went back to the science, went back to the research about what's going on here? What is this doing in the body? And lo and behold, it worked actually as good or better than acupuncture. Now, why? Acupuncture moves energy in the body through the meridian system and through the points. But the difference between a magnet and an acupuncture point or an acupuncture treatment, needle treatment, is it not only treats the acupuncture point like a needle does, maybe not quite as strongly, but at the same time, the tissue under the magnet is getting individual cellular stimulation.
Okay.
Okay, so you're doing individual tissue repair and at the same time spreading the energy out the meridian system. So I said, well, that's a beautiful idea. As I started reviewing the science and the literature, most of it was actually in Cyrillic. Most of it was in Russian or Eastern European or Chinese or Japanese or Korean or whatever. So really there was very little science in the West. I went to a conference, I was doing a lecture about magnetic field therapies, and I met this guy from the Czech Republic, his MD PhD, who got his PhD on magnetic therapies, electromagnetic therapies. He had summarized a lot of that literature, and he wrote a manuscript in what I call Czech English. So he was Czechoslovakian. So he gave me the manuscript and said, here, you can have it. So he translated 30 years of research in Eastern Europe on magnetic field therapy. So they had randomized controlled trials, they had all kinds of control studies on electromagnetic field therapies. Bonanza, an absolute bonanza. I now have over 30,000 abstracts on the effects of electromagnetic fields on biology. 30,000. That's a huge literature already.
So let me ask a question, and maybe I know the answer. The answer is there's not billions of dollars to be made on hooking people and keeping them addicted to the drug, and that's the answer to this. But you're talking 30,000 pieces of literature on this from around the world, 1 billion people, and even more than 1 billion people who've been using acupuncture very effectively for thousands of years. And I love acupuncture, but the pulsed electromagnetic frequency treatment is almost instantaneous. It was almost instantaneous in me, and I was astounded myself. And I mean, I love science, I love physics, and I'm like, how come none of us know about this when there's so much literature about it?
As you said, money and influence. It's very hard to patent a PEMF system. But when you own a PEMF system, you own it, not a doctor. Right? Doctors want you to keep coming back to them. Acupuncturists want you to keep coming back to them for their treatments. But if you have a magnetic system, you pay $2,000, $3,000, $500, whatever the price happens to be of the system you get, but you own it. You have a pennies per day treatment system for the rest of your life to treat anything, basically. Any cellular problem can be treated with PEMFs. Doesn't matter what the problem is. And then as you're talking about energy, the amplification, once you get a cell healthy, it starts to communicate to the cells around it. They start to talk to each other, and organs are talking to organs, and then you're talking to the whole body. You very, very rapidly amplify that energy into an entire system that rebalances the body.
So let's break it down a little bit, because I think people getting their head around what we're talking about can be quite difficult. And so, I share with my audience, I do work as a medical intuitive. And what I say is, how can I basically psychically read people's energy? And I explain to them, well, everything in the world has an energy imprint, and I'm just able to accurately assess that energy imprint. And we all can do something like this. We're all connected. We all have energy imprints. Illnesses have particular energy imprints very predictively. And because of all my background knowledge, my soul journey, I know what these energy imprints are very easily, and I can assess them very, very accurately. So I explain to people, you talk about you have energy, your energy's high, your energy's low. Well, that's not fake. Energy is really there, but what I'm doing is giving it words, giving it a name. So explain to people how you would tell them, and they can get their head around this energy that we're talking about.
There's a number of aspects of the actual physics of magnetic fields and how they work. Pulsed magnetic fields in particular, a static magnet or a fridge magnet that you put on the body will have an influence in the area of the magnet, but it's limited in terms of the physics, in terms of the depth of the magnetic field. So every electromagnetic phenomenon on the body goes through a process, or has a process of the energy reducing itself as it moves away from the surface of the applicator. Now, I call that radiation. So we're not talking about ionizing radiation. We're talking about non-ionizing. So whether you're listening to an earbud If you take the earbud away from your ear and move it farther and farther and farther away, the sound gets dimmer and dimmer and dimmer. That's a rule of physics. That's called the inverse square law. Magnetic fields are subject to that same law. So that's one principle. Low frequency magnetic fields have extremely long wavelengths. That means that the wavelength goes right through the body. It does not stop in the body. Nothing in the body can stop a magnetic field. Nothing. No bones, no muscles, no brain. Nothing stops the magnetic field. So the analogy is that it's like the wind blowing in the trees. You only know it's there because the leaves are shaking. Right? You wouldn't know that if you weren't standing under the tree, you wouldn't know there was a wind there unless you felt it against your body. And the reason you feel it against your body is your body offers resistance to it. And we're dense enough that the wind won't go through us, but it does go through a tree. So imagine our cells of our bodies are actually like the leaves in a tree, which they really are from a physics perspective, right?
Yes.
There's more space than there is density. So the magnetic field goes right on through. As it's passing through, it's stimulating the energy that the cells are producing. Every cell in the body, as you said, has a frequency. Every cell in the body emanates a magnetic field of its own. Every atom, every molecule has an electromagnetic field. And when you add two atoms together, then the magnetic field amplifies. When you add three, the magnetic field gets even bigger. And when you add an organ, the organs actually produce a pretty significant magnetic fields. We now have instruments that can measure the magnetic fields of the brain. And they are now being used to guide neurosurgical treatments for seizure disorders. They can electromagnetically map a seizure focus that's producing an electromagnetic field. So we know the body does this.
Okay, so explain how this relates to sickness and health, because that's where we want to get. We're working and saying, big deal. We're talking about physics and trees and all that, big deal. How does this all relate to helping someone be well?
All right, so obviously a cell that's out of balance is not going to be producing an electromagnetic field of its own that's sufficiently strong. It's not a natural, normal magnetic field. You take a sick cell, you put it next to a healthy cell, and the healthy cell is going to actually be helping the sick cell because it's got energy to be able to give to the sick cell. Unless the sick cell is so sick that it can't deal with that energy, can't take it. We see this with human beings all the time. But basically the magnetic field is stimulating the energy production in the body. It stimulates ATP. It stimulates the energy in the cells of the tissues. It not only increases the production of ATP, but also helps the body to actually take the ATP and convert it to energy. ATP without being converted to energy is nothing. It's just sitting there waiting to be activated. So magnetic fields not only increase the amount of ATP, they actually activate the ATP. Then they improve circulation, they reduce muscle spasticity, they reduce pain, they enhance healing, they stimulate RNA and DNA. There's a whole host of reactions that happen in sick cells when you provide the cells the energy that they're lacking. And all of a sudden, things start to wake up and they start to heal.
Okay, so let's talk about, I had a almost instantaneous result when, I have a friend, Dr. George Roth, who works with a particular type of technology that's pulsed electromagnetic frequency and what he calls matrix repatterning. He found that I had a head injury. I actually had neurological defects that I wasn't aware of. He showed me them. Then he put this pulsed electromagnetic frequency instrument on different places of my body for a few, maybe 30 seconds, 60 seconds. And then he went back and checked these same reflexes and they were normal. So I went from having neurological defects and abnormal reflexes to normal within a matter of minutes. How does that happen?
Well, it happens again because of patterning. It's repatterning. But it also depends on the instrumentation that you're using to measure what's wrong, what's out of balance or out of whack. And so you can repattern somebody. I can repattern somebody by telling them they're beautiful, they're lovely, they're healthy, they're vibrant, they're intelligent. You can repattern somebody just by telling them that. We see people's energy levels dropping when you tell them that they're stupid and that they're worthless and so on. I've had this happen to me. You do muscle testing, right? And
Yes.
you do that and the muscles go, it collapse on you. And I was like shocked myself. I have more control over my muscles than that. But I was amazed. The muscles just dropped like a rock. But then they fixed it just by telling me that I was actually a wonderful person, that they were lying to me. It was a mistake. And bingo, they came right back again. Well, that's energetic repatterning. But there's a difference. Magnetic fields work at an energetic repatterning level as well, but because they also work at the cell level, repairing the RNA and the DNA, you can see an improvement in somebody's arthritis by giving them a painkiller. You can do heat therapies. You can do massage therapies. You can do all sorts of things to get that shoulder moving again. But if you do an X-ray, it's no different, right? So magnetic field therapy has been found actually to heal the lesion, not just to improve the energy, but actually heal the lesion. But the healing takes a lot longer than energetic repatterning. So symptoms can get better, but then you have to keep applying the therapy over extended periods of time to get down deep into the tissues and to actually hit a repair. Because you can supply the tissues energy, right? A cell has energy, but then it has to stimulate the RNA and DNA to fix itself, to rebuild itself. That takes time. That doesn't happen overnight. So you and I can do all the wonderful work we can do for a fracture. A person feels better, they have no pain, the swelling goes down very rapidly, but how long does it take for the fracture to actually heal itself when you do X-rays?
A while, yes.
A long time, months to years. They're feeling better. They thank you very much. Thank you for helping me. But you do X-rays and they're still not healed. Magnetic field therapy is actually found to heal the fracture at half the time. Heal the fracture at half the time, not just improve symptoms. It does that too. But more importantly, it actually gets the body back to more normal quicker. I'll tell you a little anecdote. I had a little girl.
Let me just ask a question. I'm going to follow up because what I also have noticed, it's great when you have your own issues so you can try it and be like, oh, wow, this is wonderful. I noticed that based on, a lot of other treatments that I have sampled, that this one seems to be sticking. And so once it was corrected, it doesn't seem to be going back or drifting back. It seems to be more improvement, more improvement, more improvement, more improvement. And that's different than anything else that I've ever experienced where you have sort of like some temporary relief, but you still seem to have a problem. I feel like faster, stronger, better. And this is amazing. And I never knew I could be like this, especially where you're taught that as you move on in years, you don't heal as well. You're not going to be as good. I feel like, oh my gosh, I feel better than almost before maybe I had this.
Well, and I developed a concept based on my studies in acupuncture. Acupuncture has a concept that all the different meridians are basically layered, one on top of the other, and there are 12 meridians.
Yes.
And they basically start superficial and go deep. From a medical perspective, when you think about it as a physician, and you study physiology and pathology, you realize, and medicine doesn't recognize the energetic level of things.
Not traditional Western medicine, no. Not at all, zero.
But let's say we talk about a cold. I talk in 4 levels: energetic, physiologic, pathophysiologic, and pathologic. In my sort of concept, because people ask me, how long is it going to take for me to get better? I said, it depends on the lesion. So the first thing you do, let's say a cold. When you're first starting to get a cold, you feel off. You know something's coming. You don't know what it is because it hasn't settled in your body, but you don't feel right. That's energetic. The next level is physiologic. Now you start to have a runny nose, you have a bit of a fever, you're sneezing, right? Now it's physiologic. Your body's reacting to the virus physiologically. And now the sputum or the mucus coming out of your nose is yellow or green. And you have a sore sinuses. You're aching over your sinuses. That's pathophysiologic. Now there's damage to those tissues. They're not just physiologically reacting, they're damaged now. And there's a combination of physiologic and pathologic going on at the same time. Eventually, if it keeps going down and deeper and deeper and deeper into the body, then you end up with pneumonia or bronchitis or otitis media or mastoiditis or, heaven forbid, encephalitis or meningitis, right? So that's pathology. That's getting down really deep, and there's a lot of damage.
Yes.
So when you're talking about healing, then healing at the energetic level is like a piece of cake. That's when you can do meditation, you can drink some nice green tea, etc., You'll feel better right away, and it'll probably stick because you caught it early. Then, but if it goes down to the physiologic level, you could still do what you did at the energetic level, because there's always still an energetic component, even if it's pathophysiologic or physiologic. So each layer is going to take more time to reverse until finally get down to the pathologic level. It's going to take a long time to reverse.
Yes, and so it's beautiful because what I love about working on these energetic levels particularly is you can help people get improvement in whatever it is without any side effects, contraindications, horrible things happening to them. It's like, I'm like, you know what? I feel cold coming on, like you're talking energetic. I feel kind of off. Oh, my throat's scratched. And one of my favorite modalities is homeopathics, because I'm just like, oh, and all of a sudden it's like, okay, whenever I start feeling like that, within 12 hours, I know I can nip it in the bud and get rid of it very predictably. Yes. And so what I have found about energetics, especially in the hands where you start learning more and more what's going on energetically, which means a lot of times you have to suspend what you learned in medical school. You look at the energetics a little differently. You're able to help people very rapidly. Whereas before, with traditional medicine, it was just kind of a more slow process.
And doctors are trained much more at the pathologic level and the pathophysiologic level than they're trained at the physiologic level, and absolutely not at the energetic level. I describe 3 layers of doctors: doctors, physicians, and healers. Anybody getting a degree, whether it's in optometry or astrophysics or theology, and has a PhD, they're a doctor. What are you at that level? You're basically a technician. You have the knowledge. You've learned how to be that particular discipline. Yes. That's a doctor level. MDs are no different at that doctor level. They go to medical school. They go to the laboratories. They study the textbooks. They do all the things that they're taught to do. So they're doctors. They're technical at that point. But I think good doctors, really good doctors who really are aware and have a conscience and really recognize that they don't, how little they actually know. Look at the person in front of them and saying, this is a person. This is not a molecule or a specialty or a drug or the absence of a drug, right? So this is a real person. That level I call the physician level. But why do doctors go into medicine? Most doctors go into medicine because they want to help people, not because their family were doctors, not because they want to get rich. Most doctors go into medicine because they want to help people. But when you go to medical school, it's like going to boot camp.
Right? Marine boot camp for the Navy SEALs is what it's like.
Absolutely. You get brainwashed into a way of thinking. And that brainwashing, then you kind of forget why you got there in the first place. So eventually in time, as doctors mature, as they practice and practice and practice, they eventually begin to, I think some doctors actually remember why they went to medical school in the first place. At that point, medicine is just a vehicle to do what you want to do, which is what you're doing. It's just a vehicle. It's one more modality that you use to do what you want to do, to get a complete treatment program. And that's the healer. The healer will pray with you. Right? The healer will give you an antibiotic. The healer will do surgery. The healer will do all those levels, but not all doctors do all those levels.
So we need to have more healers. It's interesting because a lot of people these days give themselves the title of healers. It's challenging sometimes for me because I meet a lot of people who call themselves healers, but they really don't have any knowledge that's so deep. What do you say about that? Because that's something of concern to me, because I meet a lot of people like that who you start talking to them and they're not at that deep level. And it's a little bit frightening to me. Now, I'm not saying that because I'm a doctor, I have the deep level, but there is some background education, training, and a process that needs to be gone through so that you don't miss something important in somebody. And I see people who have the lack of knowledge, who call themselves healer, who miss something big. What do you say about that?
Well, I think everybody brings a value. The risk is that you're telling somebody that I'm the only value you need. My concept is that healing and health takes a village. So you might have one skill in, say, healing eyes, but you're not going to help me heal my lower back. Or you have other skills in healing. I remember listening to a panel of psychics. They all had different psychic skills. And it was like a panel of psychics. So somebody asked them a question, how do you deal with alcoholism? Every psychic, and now I used to think that, well, it's all coming from God, it's all coming from spirit, it's all coming from one source. But the problem is that our perception of the source is limited by our own biases, our own filters, our own abilities, our own knowledge patterns, our own spiritual evolution. So I really realized that everybody's different. All healers are different. So everybody has their own sort of level that they can work with. And they have to realize their limitations. People who come to them have to realize those people's limitations. But you start someplace, and if that works for you, then great, you're done. If that doesn't work for you, then you go to a different healer who does something different. Because as you heal, you peel another layer, like homeopathy. You peel one layer. Then the older problem comes up. Then you have to heal another layer. Well, that first healer may not be good enough to heal the second layer.
Yes, I think it's important that people understand that it does take a village, and that if you entitle yourself a healer, realize that there are other people out there with different skills and talents that can do something that you can't do. And so it's common for people who are comfortable where they are as healing to bring other people in the folds. So when people work with me, I'm like, okay, who else can I bring in to help you? I'm always thinking about who else do I know that needs to do this, because I know that person sitting there in front of me needs more than the particular skill set that I have to offer. It's like when you're raising your children, you don't just need mom and dad and grandma and grandpa and all, you need teachers, you need, the crossing guards, and everybody comes in and plays a role. And so when people say that they're a healer, okay, well, who else do you work with? What else do you do? And also, I'm very sensitive that we don't throw away all doctors who have skills in Western medicine, because a lot of times that's what's appropriate for people. They're the doctors in Western medicine now are trained, and they're basically firefighters. They're running around their office, putting out the fire. And then you have the other people who've moved into modes where they have to rebuild the house. And so the firefighter is going to have to do the heart surgery because that person needs to live. Then we can use all the other stuff to get that person in a better place. But if they die, you lost the whole battle. And so I embrace my colleagues that are doing Western medicine, and I want them to stay singularly focused on what they do well. But I also want them to open up and realize, okay, I did what I can do. Now I need to hand them off to a Dr. Veronica or a Dr. Pawluk or a doctor, somebody else. Or I'm thinking of my colleagues, a Michelle, who helps people with mindfulness and gets fabulous results in that, because I realize, that person has a mind block. That's not my area of expertise. And so here, Michelle, can you help them with that mind block that I see going on? So it's let everybody be good at what they're good at, but make sure that you're inclusive in it. But let's go back to this. This is my electromagnetic.
One point to what you're saying, if you don't mind.
Yes.
And what skill you have and what skill somebody else has that complements you does not take away from what you need to do for you to be part of that team.
Absolutely.
Right. So in other words, you can't say I'm better than.
No.
I just have this set of skills and somebody else has that set of skills. And combining those two sets of skills produces much better results than either one alone under certain circumstances.
Yes.
So let's
All right,
go back.
now we can go back to this.
Okay.
Okay, so this is, people are saying, well, what are you holding up there? This is my pulse electromagnetic frequency treatment. And, I'm a NES health practitioner, and that's a whole nother discussion. But I'm holding it up because I don't care where people start using, what device they use for pulse electromagnetic frequency. But I'm saying this is the bomb. You need to have this as part of your wellness system or disease system to be able to get better, because you have to work on your energy. And so how do people, we talked about electrical stimulation versus pulsed electromagnetic frequency. People get that confused. How do we know we're getting the right stuff?
Okay, so it does get complicated. I have a website, drpawluk.com. That's drpawluk.com. That website's been around since 2005, I think. So we've been doing this for a long, long time. I, as a physician, realized a long time ago, one size doesn't fit all. Like we talked about different types of healers and so on, different types of practitioners. So in magnetic therapies, one particular device is not going to cure all. It may get you to a certain point, and then you may have to think about other devices. On my website, drpawluk.com, we review a lot of different devices. Because of that work, I have written a book, just authored a book called Power Tools for Health. And the website for that is PEMF, Pulsed Electromagnetic Field Press, PRESS.com. And that will get you to the book. The book.
Let me just say that again, PEMFpress.com.
So that book then is a comprehensive book talking about the science, talking about the different ways magnetic fields work in the body, talks about 50 different health conditions that magnetic fields have been found scientifically to help. So there's scientific backup to this, thousands of references, hundreds of references. And then what systems to look at, and then how to use a system, what contraindications there are, etc. So different devices will help people in different ways. Electrical stim, and I review this in the book as well. What's the difference between electrical stimulation systems like TENS machines, or where you have to put an electrode on the body? That's introducing electricity into the body. So that's producing electricity like a mini electrocution. It's controlled electrocution, right? But it is, and nevertheless, it's electrical stimulation into the body. We use that in medicine to kill warts, to burn tissues, to stop bleeding, etc. when you use high-powered electrical stim. But low-power electrical stim is used by people on their own, TENS machines, for example. But they don't go deep. Pulsed electromagnetic fields, as I mentioned, PEMFs go all the way through the body. So as a result, you can get an entire brain treated with a magnetic field where you can't with electrical stim. So that's the difference between the two. They both use frequencies. Now, the other difference is that pulsed electromagnetic fields create energy in the body. They don't create it. They stimulate the body to create it. So the body makes the energy. The body's gotten lazy. It's gotten stuck. And by stimulating with electromagnetic fields passing through the body, all of a sudden, all this energy starts to be produced and healing starts to happen. PEMFs were, some of the earliest uses of PEMFs in this country were approved by the FDA for healing fractures that wouldn't heal. They're called non-unions. Mm-hmm. So if a fracture has been there for 6 months and it hasn't healed at all, now there are FDA-approved devices. You slap one of these machines onto an arm that's not healing, and they're doing treatments for 12 hours a day, and in 12 months, healed. Why did it stop healing? Poor nutrition, not proper care of the fracture itself, just osteoporosis, a whole bunch of different factors would all of a sudden cause that fracture healing to stall. Now, all of a sudden, you apply a magnetic field, and everything starts working again. And within 12 months, you've got a completely healed fracture, non-invasively, non-surgically, safely, no toxicity, and it's healed. It's back to normal. Surgery has no solutions for those kinds of fractures. The surgical solution's absolutely horrid. All right. So this is why magnetic fields work. They induce energy in the body. They cause the body to make its own energy. They stimulate the body to make its own energy.
So now you had mentioned one therapy that we know about, which is bone healing, that pulsed electromagnetic frequency can work on. What are some of the other conditions that have been shown in research to be improved by this type of therapy?
So as I said, there are at least 50 that I cover. And that's only because there's evidence behind them. But then there's over 25 different mechanisms how magnetic fields work. So they do a lot more than just those 50 conditions. But the classical ones that people use magnetic fields for are pain management, healing wounds. I had a little girl, 3-year-old girl, that tore off the end of her thumb in a door jamb, tore it off. And I've got pictures. See the suture marks where they reattached it, and the end of that thumb where they reattached it was purple. It was dead. No blood supply. She did 3 hours a day of magnetic therapy with a small little handheld device. In 6 weeks, the sutures were gone. The end of the thumb was pink. In 12 weeks, the nail was growing back.
Amazing.
Yeah. I mean, that's the most dramatic case that I've ever seen.
Can this also, like I had mentioned that I had a brain problem and a neurological problem. Can this be hope for people who have neurological damage that they've been told that it's irreversible, there's nothing that can be treated? Is there research on that?
And I didn't prime you to ask that question.
No, you did not.
I did not. But the answer is I actually did a study myself. I took 10 patients with TBI, brain injuries, and had them treat themselves on their heads, front and back and sides. 1 hour front and back, 1 hour on each side, 2 hours a day for 3 months. And we used an objective measure of brain function. It's a new instrument that's out of the University of North Carolina called a brain gauge. So we check them weekly and check them monthly. So for 3 months, they treated themselves 2 hours a day. And at the end of the 3 months, I actually had them stop it for a month and recheck them again after being off it for a month. Every one of them improved. Most of them improved their results almost completely. One woman who had 3 car accidents, had 3 head injuries, and had a temporal lobe seizure disorder, got amazing results. And she was having what she called brownouts, these sort of mild background seizures, temporal lobe seizures. Mm-hmm. Stopped completely. When she went off for the month, she couldn't stay off for more than 2 weeks. She regressed so badly. So this was completely controlling her brain. But every one of them, when I checked their brains at the end of the 3 months, after they've been off for a month, every one of them regressed a little bit. None of them went back to normal. None of them went back to their baseline, but they all improved. So my conclusion was that we were actually repairing the brain cells, which medicine has nothing to offer. And at the same time, we were also improving function. They were able to function better, which they got basically within days. They could remember more. Their brains were clearer. They had less brain fog. Their focus was a lot better. They all raved. Basically, nobody wanted to give up their machine at the end of the study.
Yes, I certainly understand that.
So yes, the answer to your question is yes, we can heal the brain.
Okay, so brain is, but what other conditions that our people are walking around with commonly? Let's talk about some of those conditions that are not, brain where they're structural. Let's talk about some of those, softy type conditions like anxiety, high blood pressure or diabetes or an emotional problem or cholesterol or conditions like that. Is there any science, we'll call it, behind that, or studies behind more of those conditions where, I could see how you could heal a muscle, I could see how you can make more brain cells, but.
Yes, absolutely. And the book is full of that. I have over 500 references in the book. So I had a patient with anxiety. So there's lots of references on anxiety. I had a patient in my office with anxiety. She was very fidgety and nervous, and clearly she was like on edge, completely on edge. It was hard for me to do my interview. She was so anxious. So I put the magnetic device on the back of her neck, over the medulla, at a low frequency, at a theta frequency. That's about 7 hertz. And had her sit there with it, and we kept chatting. Within about 10 minutes, I could begin to see her anxiety level dropping. After 20 minutes, I said, you don't look anxious anymore. And she said, I feel great. I said, what was your anxiety when I first started? She said, 8 out of 10. What is it now? 2 out of 10. So in 20 minutes, I was able to reduce her anxiety just with a magnetic stimulation to the brain. 20 minutes. She ended up getting a machine. She was using it basically 6 or 8 hours a day after that.
Okay, so how do we know that this is the electromagnetic therapy treatment versus a placebo effect?
That is a good question.
Well, let me just say something. I think that whether it's a placebo or it doesn't matter if the person's getting better. So what if it's a placebo? They got better, we got a result. But we want to know that this is better than quote unquote nothing, the sugar pill.
The research studies have been done that have been placebo-controlled trials. So I had one case. Do I know it's a placebo? I don't, because if you take it away, she gets anxious. You give it back to her, she's not anxious anymore. There's a training effect there too, isn't there? An expectancy effect. Once she had a benefit once, and you take it away, well, now you're taking away a crutch. You're taking away something that she's benefiting from. So I don't know how much placebo there is in that or not. But often one of my responses is, how much has anything else that you've done helped you compared to this? Why is this any better for you than anything else you've done? Why am I the placebo? Why aren't all these other people placebos? Now, maybe it's my magnetic personality, pardon me.
Well, is it that somebody invested in made an investment in a machine that's
subsequently, but
maybe because they spent money, all of a sudden they got a result?
Absolutely. And I expect that effect to be there. Because 50% of the benefit of anything that any doctor does is placebo.
You got that right.
And, you know, I think doctors are stupid saying, well, I don't want a placebo effect. We'll say, are you stupid? You're going to be 50% better by having the placebo effect. You want the placebo effect. Sure, you want a medical effect, but you want the person to believe that this is going to work, because then their own healing processes kick in. Right? I love placebos.
Yes.
On top of the active treatment.
And so to wrap up, words of wisdom for those people who are on the fence of figuring out, is this real or not? Is this hocus pocus?
Well, the best thing to do is to get the book, because the science is there. I mean, we could talk for 5 or 6 hours. I did a 6-hour workshop on magnetic fields and the science behind it and so on. So it's real science. And it doesn't matter whether you're a snail, a bird, a dog, a horse, a cow, or a human. Even in snails, magnetic field therapy has been found to be equivalent to 10 milligrams of morphine. They put snails on hot plates, and they check to see how much morphine they need before they withdraw from the hot plate, or before they don't withdraw from the hot plate. And they found out that they stopped withdrawing from the hot plate. In other words, they became cooked snails. But if they withdraw from the hot plate, under 10 milligrams. So they did the same thing with magnetic fields, and discovered magnetic field therapy was equivalent to about 10 milligrams of morphine in stopping a snail from withdrawing, having a pain response, withdrawing from the hot plate. Now, tell me that a snail has a placebo effect.
Yes, I know. We didn't mention during this interview, but I'm going to mention it now that this does work exceedingly well with animals, which, you know, yes, there are people who are animal communicators, but most of us are not. And treating animals with these devices has been magnificently helpful in all kinds of issues that these animals have. So if you are a pet owner and you're concerned about your pet, this is something that can be used on your pet to be able to get results when they have some type of illness.
I have 2 Westies, and one of my Westies has a history of Lyme disease, and she fights with my wife all the time for time on the magnet.
So you just mentioned another affliction that's widespread now, Lyme disease. And so I'm assuming there's some benefits for people with things like Lyme disease or chronic fatigue and fibromyalgia.
Infections, wound healing, again, back pain, muscle aches and pains, all kinds of eye problems get better, skin problems get better.
And what about the diabetic and the high blood pressure person? Well, the diabetic, all of a sudden, can we help them stop craving sugar so they can get their diabetes under control? Or what kind of...
Magnetic therapy does not, unfortunately, there's two things magnetic therapies don't do. And I have to be really careful saying what I'm going to say. So please forgive me if I offend anybody. Number one is they don't raise the dead.
Okay.
And number two, let's not do stupid things. So if we jump out of airplanes, we can expect to have a problem, right? You got to sleep well. You got to, again, avoid the things that are stupid for you. If you are diabetic and you're eating sugar, I have a brother-in-law who has a Charcot foot. His Charcot foot is being helped by the magnetic therapy, but he keeps eating donuts for breakfast. You know, I can't cure that. I can't stop that behavior. But can I help the body to be better with it? Yes. I will keep his body going with magnetic therapy longer than he would otherwise. I'll keep his kidneys functioning longer than they would otherwise. I'll keep his eyes functioning longer than they will otherwise. But, you know, I can't stop the diabetes. I actually saved a guy from losing both his legs with magnetic field therapy.
And I'm hoping that he worked with you and improved his overall health and took on habits that helps him keep the feet that you saved.
It took me 3 months to do this job with him working with me with diet, nutrition, supplements, and the magnetic therapy, and it made a difference. Now, then I lost track of him. He never came back, so I don't know what happened to him subsequently. But at least for the time that we did, he went back to his surgeon, and his surgeon said, "Oh, I guess we don't need to amputate."
Let's hope that he kept doing it.
That's all I can hope.
Yes. So, Dr.
Right?
I really appreciate your extended time. Is it drpawluk.com? We can find you also.
Correct.
So there's drpawluk.com. There's PEMFpress.com, and we can get your book called. Is it called Power Tools for Life or
Power Tools for Health?
Power Tools for Health. Thank you so much, Dr. Pawluk.
It's a pleasure. Thank you very much. Thank you for all the good work you do as well. Bring it on.